Dr. Kylie Jones, MBE.
Hello.
I can't wait for this chat.
ADHD for me all the traits have been something that's absolutely safeguarded me. I have to decide every day, who am I going to make happy? My autism or my hyperactive traits?
Society we're in that thinks people are clambering for labels to get benefit of or accommodations. But actually, as we've heard from nearly everybody we've ever interviewed, the moment they got their diagnosis of ADHD or autism, they gained a whole new level of understanding.
So you could take that sort of diagnosis element that gave you that perspective to then think, well, I'll change my environment. It's so frustrating to hear that because you know that kids can't do that at school, right? So going back to my school days, I couldn't change my environment because one size is supposed to fit all.
And then you advise ministers on who you feel might be a good fit. If somebody they're here, there and everywhere, I love that. I can feel the energy in that CV. If somebody makes a spelling mistake, I'm not going to go, oh no, it's immediately out. I'm thinking, oh my goodness, they're neurodivergent, they're dyslexic, they've got to have all of these creative thoughts and all this empathy.
Dr. Kylie Jones, MBE.
Hello.
I can't wait for this chat.
Me too. Feels like a long time coming.
And I'm going to say MBE, Services to Autism, which
Yes.
frames this conversation really well. And when we were talking just a minute ago about what you'd like to achieve and almost if you're on the train leaving, and what would you like to have said, I think we should open with that.
Yes, before I forget. Tick. There's going to be a whole tick list going on here, isn't there? I think, so my kind of story is that every time I say to someone, I'm autistic, or they know I'm autistic, and they start talking to me about autism, they'll immediately say to me, so did you get your ADHD diagnosis first or otherwise? And I go, I don't have ADHD. And they go, And by people that ask me that, sometimes it's people that don't work in the kind of psychology field, but most of the time it's people that diagnosed ADHD for a living that go, so when did you get your diagnosis? Which makes me feel that perhaps there's something there. And thinking wider about other people, it's a case of, I haven't yet met an autistic person who wouldn't warrant an ADHD assessment, and vice versa. I haven't, I've also met ADHD people who immediately go, oh gosh, you're autistic, aren't you? I go, no, I've got ADHD. And we know it's 70% overlap. And I just think, why aren't we assessing for a diagnosis of both at the same time? Our waiting lists are a nightmare in the country. Why aren't we just doing that as standard everywhere? So I say that as an absolute hypocrite, as somebody that denies that she has ADHD traits. Yes, I'm getting there, thanks to you guys and listening to this incredible podcast. I'll repeat in the bath.
If you see it as a line, this is the way I teach it. If you're ADHD here and you've got autism here, you're never going to get the slider on that scale all the way to the buffers of one end. It's going to stop. So you're always going to have... You're going to have a residual amount of ADHD if you're very autistic, and you're going to have a residual amount of autism if you're very ADHD. You're never going to get the train to the buffers. There's always going to be a coach of the other. Does that make sense?
Absolutely.
As a picture.
I'm really glad you said that as Dr. Fernandez, because that spectrum line, like for me, and I might be saying this wrong, but autism is past ADHD. It's more of an extreme version of it. So by default, almost those sort of traits are enhanced and exaggerated. And I might be wrong in saying that, but that's my interpretation of looking in. It's more of an extreme, with different character traits.
Yeah, I was going to say, and then it gets really interesting, doesn't it? That if we were to simplify things, the autistic person wants rigidity, no change, structure, everything lined up.
Yeah.
The ADHD person is just living in absolute chaos where it's complete spattergun and everything. Now, the person who's got both, as most do, if you've got both and are towards the middle of that, so you've got competing ADHD and autism, you've got chaos and a drive for impulsivity and a drive for doing things without thinking, fighting rigidity and needing order and a sense of sensibility. And that's when you get really complex ADHD and autism. Really is complex when you've got both to a relative extreme. What makes you think what makes you think that people think you've got ADHD? Where does that come from then?
I was once described as a Labrador, a puppy Labrador, which happens to be my favourite dog and a special interest of mine, so I was very happy with that. I said, well, what do you mean? And they said, well, you don't know someone, but you go to somebody's house and they've got a puppy Labrador. You open the door and like, oh my God, I love you so much, it's amazing, blah, blah, blah. They're all jumping up to you and they're licking you. I don't lick people anymore, but those sorts of things.
Anymore. I was thinking.
And it's that kind of vibe, I guess. I once, in my 20s, obviously I'm in my mid-40s now, but in my 20s, I went out for a loaf of bread and came back with a tattoo. That impulsivity, I've learned to calm that down. I think I was once at a conference and there was somebody who diagnosed ADHD at the lunch table with me. I said, can I have lunch with you? Yes, lovely. And he then asked, when did you get your ADHD diagnosis? Are you on any medication? And I said, no, why? He said, you've checked your bags 27 times in 30 minutes. Constantly on the move, constantly moving, swirling, at work. And they've all the different people I work for are really good at this, but I will turn my camera off on Teams calls if they're over 45 minutes. 45 minutes, I can hold it in. After that, I'm spinning on the chair. I'm walking up and down, pacing, those sorts of things. And I feel that with being autistic, and I kind of think the reason perhaps I've been a bit denial / protective of not going forward for an ADHD assessment is because ADHD for me or the traits have been something that's absolutely safeguarded me. I love routine. But I've learnt to take my routines and apply them in any environment. I have to decide every day, who am I going to make happy? My autism or my hyperactive traits? Because I can have a day at home where I'm in bed and I go, this could make my autism happy, right? Or me as an autistic person, this will make me happy because there's no transitions. It might not even be leaving the room. But then I'll have to have three laptops, devices open, working on lots of different things because otherwise I'll just get too bored. And then I can do that for a while. And then I'm desperately craving the alarm clock at 4 o'clock, hair and makeup done by 5, leave the house at 5:30, train at 6, ping, 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 not getting home till midnight, and then starting again at 4, kind of 3-4 hours sleep because I miss it. But then I have to make my autistic self.
So you're there in the middle, aren't you?
Yeah.
You're not.
Was that really rambling?
No, it's fascinating. No, it's fascinating because the fascinating part is, and I think we should talk about what the work you do, and the work you're influencing, because you are super productive. You are very successful, and you're proving the point that you can be, and I think that's an important point to prove. If we're going to change the narrative of ADHD, and we talk about it a lot on this program, we have to look at deficits and we have to look at impairment to get a diagnostic position. But actually, you are able to manage 3 laptops. You do blah 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 successfully. So let's talk about work. What is your work at the moment? And obviously, you're a very influential woman. Where is it you're seeking and having influence?
So I work. The problem is I will get a job and I'll absolutely love it, and then I'll see another job and think I'd really love that, but then I never leave the job before. So I have, I think, at least 6 jobs at the moment, and I must also say I'm not speaking on behalf of any of those jobs. I'm here as in a personal capacity. So since 2008, I've had a business, British Autism Advocates, which is raising awareness about autism and mainly safeguarding women and girls, autistic women and girls. And I can do that anywhere that's required, anywhere that somebody might want me to go, or mainly keynotes nowadays, and helping with training and those sort of things. When I'm not doing that, I work for the Ministry of Justice as an IPM, so that's an independent panel member. So I'm an independent person on a panel who will help to look at CVs coming in for public appointments and then interviewing those people, and then you advise ministers on who you feel might be a good fit. I love that role because I will never discredit someone for having a portfolio career, which apparently is the term for when you take a job and you forget to lose your other job. Yeah. So I would love
portfolio holder.
A portfolio holder. Apparently that's the term. But if somebody has, they're here, there and everywhere, I love that. I can feel the energy in that CV. If somebody makes a spelling mistake, I'm not going to go, oh no, it's immediately out. I'm thinking, oh my goodness, they're neurodivergent, they're dyslexic. They've got to have all of these creative thoughts and all this empathy. So I love that role. When I'm not doing that 2 days a week, I work for NHS England as co-production lead for autism and learning disabilities. So making sure any of our services are truly co-produced by the people that are going to, the people that are going to use those services. When I'm not doing that, I work for Department of Transport. So I'm a member of something called DIPTAC, so it's Disabled Persons Transport Advisory Committee. We don't ever speak out, we only listen and speak inwards to remain that trust with the department. And that's advising on two of my favourite things, which is planes, trains and boats. Actually, that's three. So that's very exciting. And when I'm not doing that, I'm an author, but I also help advise on safeguarding accessibility internationally. And when I'm not doing that, I'm trying to find another job to add to the portfolio.
You're such a force for good. Can I just ask the name of the book that you've written?
Yeah, it's Safeguarding Autistic Women and Girls, Strategies for Professionals. I like a good strategy.
So, dad of two daughters, we've got to know each other well outside of filming today. And I think it's really important with what you do and how you work, you have stats and data that I think is important to share. And I think, again, mentioning my two daughters and the safeguarding of women, I think, if you share some of the stats that really need to be amplified so that kind of vulnerability piece is really kind of blown up and amplified.
Yeah, so I went to the United Nations in 2014 and I was speaking about the vulnerability of being an autistic woman prior to diagnosis, and I'd experienced abuse in my life from a very young age, very, very socially vulnerable. So I did a survey and it came back to say that 91%, I asked the question, if you're autistic, have you ever encountered abuse? And 91% of autistic women had. I thought that's a bit high, but I'll take it to the UN. It's kind of what the survey said. That was then sadly proved as the correct statistic in 2022 by a Australian and French research, but with a spotlight on sexual violence. And over 50% of those who'd experienced sexual violence, of that 91%, were before the age of 15 and more than once. So it's thinking about, obviously that's from research based around autism, but thinking about wider, as we said beforehand and just now, I've never met an autistic person that probably couldn't benefit from an ADHD assessment and vice versa. And I know there are some phenomenal ADHD advocates out there raising the vulnerability, but I think if we can say that for autistic women and girls, we can probably sure as hell say it for women with ADHD as well.
Yeah, I did, and many other stats that are as horrific as that. And there is no doubt, is there? And I look to you as someone that's learned in the field. A neurodivergent woman, especially, but not uniquely to women. Many neurodivergent men are incredibly vulnerable.
Hugely.
And that vulnerability, we talk about, we talk about ADHD, impulsivity, hyperactivity, and so on, and inattentiveness. We don't talk about, we keep making this point in the program, we should continue to make the point. We don't talk about rejection sensitivity. We don't talk about difficulty controlling emotions. We don't talk about vulnerability because of lack of self-esteem. We don't talk about vulnerability because of lack of streetwise skills. And I was with a parent of a young girl the other day, and we were talking about her daughter who's age 12, and she was struggling to understand her daughter's challenges. And I said, well, science says, and we like to follow the science, the science says the emotional part of the ADHD brain is underdeveloped at the age of 12 by a third. So in a 12-year-old body, you've got the emotional wherewithal of an 8-year-old. Would you give an 8-year-old agency for her own decisions? You wouldn't. You absolutely wouldn't. And we don't make these links often enough to actually coach people to understand that level of vulnerability. And, you know, without getting really overly political, we've got NHS England saying there's too much ADHD, it's costing too much money. We've got a government who today have announced another review of why there is more ADHD being assessed and diagnosed and why is it costing us so much. And we're missing the point if that's what we're focusing on. That vulnerability, that 91% of autistic girls being that vulnerable to abuse. And an 8-year-old in a 12-year-old body, same for young boys being led astray, a 16-year-old boy being emotionally 12 or 13. Would you give them agency? At 17, would you give them the keys to your car if you know that emotionally they're 12? You wouldn't. We don't seem to bring that vulnerability into systems and processes and decision making. We don't give people the awareness to be informed. So your use of stats is powerful, because I'm keen to know, what was the UN's response?
Well, they immediately then said to me, would you like to come and be mentored? We've got a brilliant female mentor here, a lady called Fumzel. And she said, it's for young women under 30. I said, well, I can't, I'm 32. And she went, well, you could lie. No one's going to ask you your age. And it hadn't occurred to me that I could lie. So I just thought, well, I won't say my age. And I didn't realise that the person I was being mentored by until she started mentoring us and a small group of women much younger than me, or at least 2 years younger than me, that she was Nelson Mandela's vice president for South Africa at the time, and then had become the lead of UN Women. And people were very, very interested in that stat, not just in the room at the time or in that mentoring that went on afterwards. But I think it's something that it was so difficult at the time, because a lot of people back then still didn't think that a woman could be autistic without an additional learning disability. Trying to get support to safeguard us was a bit like ringing up Greenpeace going, the mermaids are really vulnerable, come and help the mermaids. They're like, they don't exist. So it's a different landscape now, but it would be a bit like that. So it was a very difficult day, but also probably one of the proudest days work-wise.
Just on that whole, almost empathetic from a dad of 2 daughters and that stat, which I find shocking. What if anyone's watching this, whether they're a parent, whether they associate with the fact that there's a vulnerability piece there? Yeah. What advice can you give back into, with all the knowledge you've got from your own lived experience to the work that you do, that would in any way, I don't want to say preventative because that's almost not fair on you, but you know what I mean, that advice about what someone can do in their capacity to try and reduce that stat from their own activity, their own agency?
I think it would be a case of, let's say you've got a teenage girl, let's say she's got a new boyfriend or girlfriend, and you can see as a parent this is not safe, or the boyfriend might be a lot older, or they might think it's a relationship, but it's not, they're being used, and all of these kind of things that come to the core. I think it's a case of always keeping that open communication without it looking like I'm telling you you can't do this, because all that's going to do is mean that we're not going to talk about it again.
And they'll find a way, right?
Yeah, absolutely. And there are a lot of older men that do prey on neurodivergent women and girls. So having that open comms, being careful to ask the right questions and knowing how to phrase those questions. And one top tip would be, when someone comes back from an event, say, tell me the best thing and the worst thing that happened. or if they come back from school or from college or from uni. What was the best thing and the worst thing about your day, about your term, or whatever that might be, or on a phone call? And I just ask that question every day, because if you were to say to someone, how was your day? Yeah, good. Because it's quite an open question. Or, for example, you've got a girl that's really, really good at science, and she was at school and she got an award for science. But on the way home from school, she was mugged for her trainers. How was school today? School was really good. I got a certificate. Because you didn't ask, how was school today and how was the walk home? So it could be taken quite literally. And that's a case of something that did happen once. And if you ask what's the best thing and the worst thing, and just do that every day, and not just when you suspect that something's not quite right, just do it every day. And parents join in as well. Oh, the best thing was blah, 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 and the worst thing was blah, blah, blah. It could be something really simple. But with those questions, you can start as a parent or a loved one to build, or even a friend if it's an older woman, to build up a picture of what's kind of happening for them. And by building up the picture, you can go, okay, I think they need some support, or actually they're okay at the minute. And just asking that question.
It's interesting. I want to come back to something you said a moment ago, but my academic supervisor, when I did my PhD, was very clear. And if you ask a bum question, you'll get a bum answer.
Yeah.
And you know that at the highest level of my academic career, I've never lost that. And if in parenting you ask a bum question, you'll get a bum answer.
Yeah.
What is it you're trying to answer? What is it trying to ascertain by asking that question? Is it just a flippant, I don't give a damn, but I just want to hear your voice? Or do you actually want to know and safeguard that vulnerable person? And safeguarding itself has become an industry that's lost its way to some degree, hasn't it? What do we mean by safeguarding? It is literally protecting people so they can get through. And if they have a vulnerability, protecting them against that vulnerability. Talking of which, earlier you mentioned that being autistic, was where you were in the conversation, does not necessarily lead to having special education needs.
Yeah.
And I want to explore that with you, because I got excited when you said that, because I think there is an element of the society we're in that thinks people are clambering for labels to get benefit of or accommodations. But actually, as we've heard from nearly everybody we've ever interviewed, the moment they got their diagnosis of ADHD or autism, they gained a whole new level of understanding. And not one of them has said, and then I could go for a different benefits package, or I could ask for accommodations. It was actually about the human psyche of understanding yourself. So can we go back and explore your profound statement that was just trotted out about being autistic does not necessarily mean that you have special education needs.
No. Yeah.
And you clearly believe that, because when I put it back to you, you were nodding and smiling. And I'm enthused by that. So let's explore that for a second.
Well, I think historically it was the case that more men were diagnosed as autistic because they could be diagnosed as what we used to call Asperger's syndrome, which is my official diagnosis, Asperger's, so, which were kind of related to you're autistic, but you don't have any intellectual delays or what horrible, I don't like using medical terms, but you know, those sort of things. But we didn't diagnose that for women. So there's a bit of misogyny going on back then.
Well, it has been throughout the whole history of mental health, hasn't it?
Yes.
Nasty. No, yeah.
Yeah. So that's an interesting point, and I think if we think about ADHD with that, the way that women are coming into clinical for an assessment. And I know from speaking to health colleagues that it can be very frustrating for the clinician, because they've just waited 3 years to come and see me. In Wales, it's up to 7 now. 3 years to come and see me. And actually, they've sent them to the wrong clinic. Or actually, yes, they are autistic, but the thing that could help them most is some ADHD medication, and then we'll come back to that. So I think we just need to have that dual assessment. I think
that's the number one thing, isn't it? Yeah, join them up.
I think, and from running a clinic that did both ADHD and autism assessments, the strategic difficulty there is that the autism assessment is so materially different to an ADHD assessment that they are clinically separate. But I think in support of your argument, we screen at 360, ADHD 360. For every patient with ADHD is screened for autism. And autism is screened for ADHD. And then the clinical decision is which one of these is paramount.
Yeah.
Which one of these do we need to go to first?
Yeah.
And with most patients, not all, but with most patients, the ADHD is the loudest. And you can quell that noise, you can dampen that down. I refer to it as clear the fog. And if you clear the fog of the ADHD, you then get to see what the autism is. And then you can deal with the autism with clarity. You can't deal with the autism if the noise of the ADHD is completely throttling it and choking it out. And you remember we interviewed Archie many moons ago now, it seems, on this program. And he's a great example of ADHD and autism. And when we didn't know his autism was there until we quelled the noise of his ADHD. And then his autism was allowed to come forward, if that makes any sense. It almost meant that psychologically he could be who he was because the ADHD noise was dampened. And then, as you just say, you don't necessarily treat autism, but you do understand autism, and then you can accommodate autism and you can enable an autistic person in a completely different way. If the ADHD is drowning that out, you never get there. And so it's that dual screening, I think, is the way forward, working out then a clinical decision, which one is the loudest and where do we go, and then take it. And to amplify that one stage further, Professor Tom Brown, who passed away earlier this year, one of my mentors, his autistic patients, he would treat with a mild dose of methylphenidate and ADHD medication.
Oh.
And it was groundbreaking. And when I said to him, well, hang on, we may treat for anxiety with autism. He says, yeah, but if we are going to use the stats that nearly everybody with autism has a splattering of ADHD, let's just get that dealt with, get it off the table so we can see exactly what we've got. And that's just brilliance. That's just medical brilliance. So it's refreshing to hear you say that there's no automatic special education need. I'm not saying they're not there, because of course they're there. Many people have those needs, but we need to rid ourselves of that means that means the other. Because it goes back to when you've met one person with ADHD, you've met that person with ADHD, haven't you? So that's a really refreshing perspective. I think if we could understand it more, we'd be in a healthier place with people's opinion.
Yeah, and I think we need to remember that a lot of people, I mean, I got my autism diagnosis. I believe that my doctor changed my life and saved my life. It helped me kind of rid shame, because lots of experiences that had happened to me as part of being that socially vulnerable younger woman, you carry that shame and you kind of think, well, actually, I understand my vulnerability. I understand why I was vulnerable. You know, I'm not a bad character, or not stupid, or all of those sorts of things. I certainly didn't, and I still don't claim any benefits for the fact that I'm autistic. I just worked harder and thought, well, actually it helped. It helped because I then could kind of go, instead of going, oh, I'm in this work environment setting and I'm not thriving, it would be, oh, well, I'll take myself out of that environment, then I'll work for myself for a bit, or I'll do this for a bit, or that for a bit. And that really helps, because I could kind of go, I'm not broken, I'm different. I need to find an environment where I can thrive, rather than keep forcing myself into a typical workplace environment. So it really helped. And I think if there are autistic people with ADHD that are in receipt of benefits because of their autism or ADHD, there's absolutely nothing wrong with that.
Correct.
I think if we had more autistic people and more people with ADHD in really good, well-paid, solid jobs, then there would be less people on benefits, full stop. I think what we need to concentrate on the employment or lack of employment, suitable, accessible, maintainable, sustainable, relevant.
There's a lot of people we've spoken to on this show, and I speak to personally, professionally, that feel unemployable.
Yeah.
And that sort of ends up often meaning they go into that entrepreneurial world, become a founder, because they haven't found an environment that works for them. So I take that sort of diagnosis element that gave you that perspective to then think, well, I'll change my environment. It's so frustrating to hear that, because you know that kids can't do that at school, right? So going back to my school days, I couldn't change my environment because one size is supposed to fit all. And then I didn't thrive there at all. Marissa Poster, who founded Perfect TED, who embraces neurodiversity and in the company structure to allow them to find the best way for them to thrive. And the business has been valued at something like 200 million. And there's, so there's
I want that type of ADHD.
But isn't it great that she recognises, so she'll get excited if she's interviewing someone for a role and they've in any way put it on their CV or it comes into conversation because she knows she can vibe off them and then she can work out how they will get the best out of it. So I think that piece of the environment and changing it to suit you is massive. And the more the employers can do that, the more that can be brought into the education piece, will allow autistic, ADHD people to then find how they thrive.
I think you're so right, John, as well as environment. People automatically think, okay, we'll have lower lighting or we'll have more flexi working. Actually, it's not just the environment. It's like, what does that look like? Are they expected to, whether they're at home or in the office, are they expected to sit down for 10 hours a day? Or is it the case of, well, actually, there's a meet here, there's this, that kind of kinetic learning, kinetic working, and being able to then also have a break day going, okay, well, they probably had 6 hours sleep in 4 days. We should probably go, right, you're going home. And if you need to have your laptop on there and do the best you can. But that kind of environment and that culture, workplace culture as well, I think is so important. It's and it's not hard to do and it's not expensive to do. It's just a change of mindset, which is what you both do so well, is changing the mindset. When I was at the book launch. Yeah, when I went to a book launch for Unstoppable, I was like, it's just I felt like I was walking into, a time machine 20 years in the future where this is how we talk about neurodiversity, because it's not always like that.
See, I only know that. That's really, I love the fact you said that because I haven't got the prejudice. I've kind of muddled my way through chaotically to get to 48 years old and be diagnosed a few months ago. And then all I'm doing is now learning real time. And it's a pleasure to be able to meet you and others where I can then have these conversations. But that book launch community, if you like, that came together for that, that's all I know.
We could feel it.
That's all I know.
There was a really good
So we need to keep growing that, right?
Yes.
Because I didn't know there was I'm learning from you and others that there's a very different feeling. And we need to try and, make the community element full of what we've got now.
There's a cultural analytical tool that I studied when I did my first degree, which was in business, Johnson and Scholl's cultural paradigm. And it splits culture into things like, what are the visible stories? What are the visible signs and symbols as you walk around the building? What are people feeling and what have you? I wonder if anyone's ever designed the cultural web for a neurospicy workplace. And it's exactly what Marissa and we talked about and exactly what we've done at 360. And that's another springboard of consideration, really. Question for you, bringing John in as a way of wrapping up this amazingly informative mindset meeting, really. So John's got 2 teenage girls.
Yeah.
Possibly neurodivergent. So if we accept the paradigm that if you've got ADHD, it's a bit of awesome, you've got a bit of ADHD. What's your core message to an aware dad with 2 young women who are likely to be vulnerable? What's the best advice we could give a dad?
Well, I think, knowing John and his family, that they're probably doing this already, but for the purposes of other people at home, confidence. If you're different, you've got to be confident about it. And if you can, males or females, but particularly in daughters, I think it's quite important, keep filling their bucket of confidence up and up and up and up and up, because it's got to get knocked, be that through rejection sensitivity, be that through life in general, be it through relationships, friendships breaking down. Confidence is, particularly for us, definitely if we're perfectionists, which I'm guilty of as well, the more confident somebody is, the more immune they are to, can we swear here? Arseholes. So I think that just that filling, we can use a different word to that.
So giving that self-belief, reinforcing that self-belief, because we can't give resilience. People grow resilience, don't they? But if we give them the elements, the ingredients of resilience, just what I hear you saying, keep giving that positive reinforcement, that confidence, that knowledge of who you are, that awareness of why it's difficult, those kind of things, feed the knowledge so that the resilience can grow out of it. It's almost like ingredients into the cake mix, isn't it? And then the resilience cake grows out of it is what we would encourage dads and mums, but I think dads, especially with daughters, it's a worthy conversational piece to capture, isn't it?
And thanks for asking the question as well.
Well,
I wanted to ask it, so it's like I wanted to know the answer.
Yeah.
Confidence.
A great way to finish. Congratulations on everything you do.
Thank you.
And when you talk about 6 jobs, I wondered where you were going to go with the 6 jobs. And you listed the autistic person, and you listed each job, and you talked on, right, when I've done those 2 days, I do the next day. And I would suggest that it is not that ordered. And I would suggest it's not that linear. But anybody and all of those jobs are for the greater good of other people. So
and you so much to help with that, and you made time among your 6 jobs to come and sit with us today.
That MBE is well deserved. Congratulations on that. Thank you.
Thank you. Appreciate it. Thanks for having me.